Hi you, here is your tutor, Nurse Judy. Welcome to Scientia Nursing. Today we're going to continue the EKG series, taking the rhythms one at a time. The first EKG interpretation we're going to be talking about is normal sinus rhythm. Normal sinus rhythm is the gold standard. It serves as a baseline for identifying abnormal rhythms such as bradycardia, tachycardia, atrial fibrillation, and different types of heart blocks. Let's talk about the electrophysiology of a normal sinus rhythm. Remember the SA node from our previous tutorial. It is the natural pacemaker of the heart. The impulse conduction for a normal sinus rhythm starts from there. When the SA node located in the upper part of the right atrium fires, it triggers both atria to contract, emptying their contents into the ventricles. This is called atrial contraction or depolarization, and it is represented by the P wave. The P wave on the normal sinus rhythm strip is slightly raised. The impulse travels down to the AV node at the bottom of the right atrium. The AV node delays for a little bit and allows the complete filling of the ventricles. This is usually the flat line noted between the P wave and beginning of the QRS complex. The segment is called the PR segment. The AV node is also known as the gatekeeper because it waits for the right time when the atria are fully emptied to send impulse to the ventricles through a pathway. The impulse sent by the AV node goes through a pathway called the bundle of His and then splits into the right and left bundle branches, carrying the impulse to the right and the left ventricles. The Purkinje fibers attached to the branches eventually deliver the impulse to the ventricles, allowing ventricular contraction seen as the QRS complex on an EKG strip. When the ventricles are fully emptied, then they relax, and that is called ventricular repolarization, and it is seen as the T wave. For a rhythm to be classified as normal sinus rhythm, it must meet the following criteria. The rate has to be between 60 and 100 beats per minute. The rhythm has to be regular, and you know this from the R to R intervals. Sometimes we can use a caliper to measure this. The P waves, which represents the atrial contraction, has to be present, it has to be uniform, and it has to always precede each QRS complex. The PR interval has to measure between 0.12 and 2 seconds. And the QRS complex has to be narrow, measuring less than or equal to 0.12 seconds. The T wave must be upright and normal. And the QT interval, which represents the total ventricular activity, that is the contraction and relaxation of the ventricles, it has to measure for men less than 0.44 seconds, and for women less than 0.46 seconds. There are 4 steps involved in interpreting a normal sinus rhythm on an EKG. Number 1 is to determine the heart rate. You count the R waves in 6 seconds and multiply by 10. Step 2, assess the rhythm's regularity using the R to R interval measurement. You can use a caliper. Step 3, identify the presence of a P wave and the morphology of the P wave. Morphology, that is the shape of the P wave. It has to be slightly raised. Also, step 4, measure the PR interval and the QRS duration and make sure they are within limits. This brings us to the end of this tutorial. Please don't forget to like, comment on what else you would need me to talk about, and share with your friends and loved ones. Lastly, subscribe to my channel. Thank you.